Record.
Let's see.
Okay, we're recording. We're on air. We're not on air. We're just recording. But but anyway, so would you tell a little bit about who you are, and then the way I was thinking what kind of questions to ask you, and honestly, I didn't come up with any. So why don't you just say what you think about the current situation? Because I just want to know what you think.
Sure. So I'm Rod Hochman. I'm a physician and been a physician for over 40 years now, and I'm an immunologist, rheumatologist by training, and run a large health system in the Western United States with 52 hospitals and 1,000 clinics. And we take care of about 10 million patients a year. And we're doing this, and lo and behold, we had the first case of COVID-19 now on January 21st. And the patient had told us that they were sick, that they had been in China, so we were ready to take care of that patient, diagnosed them, got him better. But what it told us is that this is not going to be the last patient we saw, that regardless of what the rest of the country was thinking, we knew that if there's one patient here, there's going to be many, many more. So what helped us is that we started preparing, working, and getting ready to take care of what we knew was going to be a lot of patients, which we're now seeing across the whole country. This is a whole new experience for the United States, having a pandemic and not being able to have a cure or a treatment for this. It's really made it what's made it challenging. The only way that we've had to kind of slow down the spread of this virus is by doing something like closing everything down, which is for people not to visit their friends, to stay home, to be socially separated, was the only treatment we had to really slow down the course of the virus. The good news is that that's working. The bad news is that it's really hard on people, because after all this amount of time, people are getting really a little bit crazy being locked in their houses and being able to do everything. But we're starting to see things get better in the hospital, and less people are dying, less people are in the ICU, and people are getting better. And it depends on what part of the country you're in, but you and I are talking from the West Coast, from California and Washington State and Oregon, and those states are doing actually really, really well with taking care of the pandemic. So far, so good, more to come.
But the clinics that you are CEO of, they're in 7 states, right?
Right. So they're in Alaska, Montana, Washington, California, Oregon, New Mexico, and Texas. And we keep track of what's going on in all of our clinics and all of our hospitals. Every morning, we do a team meeting with 450 people. So we all discuss how much protective equipment do we have, how many patients are in the ICU, how many ventilators do we have. So we plan out each day and then decide what we need to do and where we need to go, including how much we're going to talk to the government about getting money to care for these patients and what we're trying to do. We stay very organized each day in terms of how to do it. Otherwise, we're going to get lost and not be able, and including doing research, right? So we have 7 research trials ongoing now with different medications for COVID-19.
In your hospital system or in the United States?
In our hospital system. So there are probably 30 trials all around the country that are ongoing with different medications, different types of vaccine therapy. So a lot of that's going on, and we're accumulating the results and trying to figure out what works the best.
So what do you think would be the timeline, like a realistic timeline? 6 months, a year, what would it be?
So the ultimate, you have to have a vaccine. In order to take care of COVID once and for all, you have to have vaccine therapy. It'll probably, most optimistic is November, December of this year. Probably full scale that you could kind of give it to everyone, it's probably going to be January of next year.
January, okay.
You know,
Right. Wow.
that's for vaccine therapy, because the only way we're going to conclusively stop COVID-19 is with a vaccination. The
Mm.
drugs and things that are out there, people that are infected, it's had to help make them better and help them get over it. The thing that's interesting about this infection is that there are a lot of people that have had COVID-19 that didn't even know they had it. They had a sore throat, they didn't feel well, and we're finding that there are a lot of patients that and people that are relatively asymptomatic. So they think, well, I just had a cough, a little sneeze, it wasn't anything. We end up testing them and they're COVID-19 positive. And now we're actually looking at antibody testing. So we can say, like, if I took a drop of your blood from your finger, I can tell whether you had been infected 3 or 4 weeks ago. And that's helping us understand how many people may have immunity because they had a viral infection before. So that's really going to be helpful to us.
How long will this immunity last?
That's a great question. If you look at the history of other viruses, it's usually permanent for that virus.
Mm.
So, but people don't want to say that. They don't want to overstate it. So they say, we don't know. But the true answer is that most of the time, once you have antibodies to a particular virus, you end up curing them. That ends up being, the end of it.
And
But
if it
since
mutates?
this is, what's that?
And if it mutates?
Well, now this virus can mutate a little bit, but it's not been significant. We've kind of they've looked at strains across China and Korea. It's not a significant factor.
Can I ask you this question? So like yesterday, I watched for like Daily Show, and now it's not 6 feet, now it's a lot larger, and like sole of the shoes is how the virus is spreading. And this kind of what's going on with that?
Don't listen. You know what I tell people? Turn the TV off, because I think
I
people are
did, by
crazy.
the way, I did.
Because people get really totally insane about this. So 6 feet's probably good. It's like, I'm not talking right into your face. Like we all have friends that get really close to us. You really want to keep some separation. And then as we go through the next few months, when you're out in public, it probably makes a good idea to have a mask on. The mask doesn't protect you, it protects someone else. So that also helps. This whole thing about communicating virus on your packages, on your mail, they have people like, oh gosh, the virus doesn't get transmitted that way. And I think all it does is it drives people crazy. So I think a lot of that, I listened to that. And then I listened to one researcher from Harvard that said, oh, we got to keep this up till 2022. And I said, we can't do that. There's going to be nothing left. There are going to be no places, people already are not getting enough food to eat. What's going to happen? So I think we need to be just really practical about how we do these things. We're already planning on how you start to open things up slowly and carefully. And we're going to have to do a lot more testing to understand. So as people start to do more in public, if they get sick, we have to be able to test them. And then let's say if I've been together with my friends, how do we let them know and get them tested? So there's a rational way to do it, but some of the stuff that I'm hearing is getting crazier on TV. I turn it off.
Okay. Can you please tell me more about the crazy stuff that is crazy? Because it's very hard to know how to source the information. So out of all the people, you're the most competent. Can you please just tell me what is crazy and what is not crazy and what are the safe practices?
So safe practices, so I'll tell you what's not crazy, right? So great hand hygiene. So what I tell people, like if you picked up a package and you don't know where it was from and you brought it home, before you do anything, you wash your hands, right? You wash your hands really carefully. Then you go back. So it's all that. It's also getting used to not touching your face all the time, because that's how you can move things around. The other thing is limiting your contacts, right? So the more people you're in contact with, the greater the probability of getting infection, right? So if you're staying at home, you're with your friends that you're always with, in an apartment, you're not going to spread it. But let's say if you're going out, let's say to a restaurant or somewhere else, which we're not doing now, that's how you spread it. If you go out to the grocery store, I would always make sure I had a mask on if I went to the grocery store. I keep a distance. I don't want to be in a crowd of people, because the closer I am with a lot of people, the more chance I may get, a virus. But those are kind of practical, common sense things to do. And some of the other stuff about wash everything that comes into your house and do this and that is a really it doesn't significantly help you. Remember, the other thing about COVID-19, 80 to 90% of the people that get the virus actually do really well. They feel sick for a while, but they don't have to go in the hospital, and they don't have to go in that. So the good news is that most people do okay with this. The people that don't do well with this are people that get short of breath. So what I tell people, if all of a sudden you're finding that you're short of breath, that's a danger sign. You need immediate medical attention. That's a thing where you've got to call a doctor, you've got to get attention, because when we've looked at the patients that haven't done well, they're the ones that have complained of shortness of breath. And they say, wow, just a little short of breath, danger sign. And even in young patients that haven't been ill, that's a danger sign. We got to be very protective of the elderly and chronically ill people. So like nursing homes, all of those, they need to be scrupulous about how they do hygiene and how they, keep the number of visitors limited. Those are all the things that are making a difference in terms of keeping the spread down. Like Washington State started social isolation early. So already all of the rates are going way down. They were high and they went all the way down. So all those things work. Some of the other stuff like, trying to take hydroxychloroquine on your own, or trying to take any medications or vitamins to prevent getting sick doesn't do anything.
Okay. So if you have a shortness of breath and then you call your medical provider and they don't want to see you because they monitor your symptoms yourself, because that's what everybody who I know who have some kind of flu symptoms, they call their medical providers and they've been told to stay home, self-isolate, right, monitor their symptoms, but they could not go to hospital. So and if you have a shortness of breath,
But if
you're told to stay home, what do you do?
Have shortness, you go to the hospital. You got to go to the hospital. I mean, what's happened when people start to get short of breath, it's a danger sign. And that's when I would call, because a lot of times you go downhill really quickly. Like if you start, gasping for air, and, it's part of the symptoms that you have, that's time to go to the hospital and have someone see you.
So here's a question. So when you need to go to hospital.
But that's also a small percentage of people.
You need to go where? You need to go call your provider. You need to go to emergency room. You need to,
I'd start with my provider. If I didn't get a response, then I would call the hospital directly. And if I didn't get a response there, I'd call 911 and have someone pick me up. Because once you start gasping for air, that's a really critical sign that you're going to go downhill. And that's what we've seen in patients. So, but that's the good news, though, is that's a relatively small number of people that get those symptoms. But that's the one. If I have sweats and aches and a sore throat, I would keep myself at home. I would treat myself like I would if I had the flu. I take fluids, I'd rest, I take, do that. And usually you'll get better. So the bad thing is then if you're sick, to go out and spread the virus to other people. And, but if you're starting to get short of breath and that's a danger sign, then you really need to get help.
So I'm curious. So for example, I live in a community, right? There are a lot of people who live in the same house. If one of us starts getting a symptom, there was the moment where it was hilarious. I started when I started getting nervous, I bought a bunch of weed. I was smoking. Then I started coughing. Then I immediately got scared and I locked myself in my room for a whole day where it was just, oh my God, I'm infected. Nobody come near me. And my roommate started bringing me food to my door. And I was a prisoner in my room. And then, one day not smoking weed and I started coughing a lot less. And I was like, okay, never mind, false alarm. This is not
Oh,
COVID-19.
this is
But it was like a weird situation. So if I get sick, how do I isolate myself from the people who live in my house?
sure. So let's say you got sick, right? Let's say you tested positive for COVID. You isolate yourself in your room. You would try to keep, everyone would have to do really good hand washing, leave you food at your door, and try to keep as separate as you possibly can. It's hard though when you live with a whole group of people, so, but you try to do that as much as you possibly can. It's really important when I tell a lot of people at this time, this is not the time to smoke weed. This is not, if you can avoid smoking at all, because you don't want to compromise your respiration in any way. So edibles are
I,
preferred
I
over.
switched. I switched quickly. Yes.
Right,
I switched. That was a good
right.
advice.
Yeah, edibles definitely are the way to go. And I would just recommend them in the future because you don't want anything that's going to compromise your lung function. And that it always does. So
Yeah, I'm just not a smoker and I don't smoke. I don't smoke
yeah.
weed usually because I'm never really that stressed out. And I thought like a couple of hits a day is not going to do anything, but it did. Like I started coughing right away.
Well, it's all of those things. The sales of like wine and alcohol have never been higher because people need to. They take it as an anti-anxiety. There's a lot of people that have anxiety. I've got a number of calls every day, and I call it verbal Xanax. You got to just get people to calm down a little bit because they get anxious. They turn on the news. Then they're worried about their work. They're worried about a lot of different things. So it's really understandable. The whole mental health thing is really something we've been looking really closely at. So we said the first wave is the COVID-19. The second wave is mental health, because almost every disorder is going to get stressed out by this whole situation. So we're actually, for the folks that are the caregivers, the nurses and the doctors, they can actually sign on and get help online from a therapist or someone else to talk to because they're under so much stress at work and everything else that's going on. So we're really thinking a lot about mental health as we think about COVID-19 because they think it's going to induce a lot of stress and a lot of, a lot in terms of mental health.
So would you talk more about this? Because this is very interesting. Like, for example, I'm very interested. What is your mental health hygiene? Because I've talked to you quite a bit and you always just seem to be together. And I honestly don't know how are you together under this type of circumstances.
So it's 42 years, right, of doing this, right? So
Okay.
I lived through the whole HIV epidemic, when we didn't even know what HIV was. We were seeing all of our patients were dying. We didn't understand what was going on. And then a lot of people got very afraid of HIV and I'm like, how does that get communicated, everything else? And so you kind of deal with this all the time. So I have to say you're trained to deal with these situations. So if a patient codes in the hospital, you have to take care of them. You got to figure out what's wrong with them. Otherwise, they're going to. So that kind of gets you there, and you realize that you have to stay calm. You have to give solid advice. You got to be able to do that. And I think most physicians are like that. Some physicians aren't, but for the most part, it's I think what we get trained to do. And I think it helps me a lot running a health system. I apply the same thing to running a health system. People said, boss, we're running out of money. How are we going to pay our nurses? And I said, okay, we'll figure it out. You take it one step at a time. But it's really, I think, important in crises like this that as a leader, you have to stay really calm. Otherwise, you get everyone else really nervous around you. So I think
So,
it's
let's think about it a bit. So far, what I have heard, is you're still a human. And even though you are trained as a physician, this is a very unique situation. From what I understood, from what I've heard from you last time, you have 128,000 employees, right? they're now in
Exactly.
direct risk. They're risking their life now. So
Right.
this is unique in this in the magnitude of, like, you're not just making life or death decisions for people who are your patients, but you're also making these decisions
Or for your
for your
people.
employees. So so if you were to, like, I understand it's hard to think about, but if you were to break down how do you stay calm in this situation, like, for example, one step at a time. One step at a time is something that I just couple of days kind of came up with. Like, I just invented a wheel. So for example, uh, one of the people that I feel like I need to calm down is my mom, you know, or just my parents in general, because they're really worried for me, because they live in Russia. United States in the news is like number one and everything. They're constantly worried. I call them every day, and then they worried. So they ask me two things, like, are you healthy? And then they don't trust me that I'm healthy. So the only way that I can prove them that I'm healthy is like to talk to them for an hour so they can hear that I'm not coughing, you know? So, um, but then they were like, but what are you going to do in a month? And I'm like, one day at a time, one step at a time. Today was good. This is what I did today. So like that seemed to be working for me. And that you just named it, like one step at a time. Uh, but I'm pretty sure there's still some other practices that you have figured out. And if you could name them, I think they will help a lot of people.
Sure. So I think for our 120,000 people, we think about what are we going to do tomorrow? What are we going to do in 2 days? And then what are we going to do 6 months from now? And we just think about it in those terms, but we kind of take it and we go through one step at a time. So a lot of my people were worried about April, and they said, well, look at all the cases we have. We're not bringing in, our financials are bad. I said, but let's concentrate on May. We're going to work on how we do it. And what we haven't done is we haven't let go of any of our people, our employees, right? So we kept everyone on board. We paid for their child care. We're doing all that because we think during a crisis, you've got to put all hands on deck and make sure that we're all together. The other thing that we've done is we created teams of people. So we have 120,000 people. We're in 7 states. I can't run everything, right? So we set up different groups. So this group's working on government relations. This work is working on supply chain. This group is working on clinical. This group is working on operations. So they're all working on their thing. And then in the morning, we all talk together. Everyone reports in. But I expect each one of them to have full control over what they're doing. So as a leader, you got to give control up to other people so that they can do their jobs. And we have to listen to the people in the field that are actually doing the work, because they oftentimes know most of what's going on. So we have a very open dialogue. We don't mind. People are upset, and the main thing that the frontline caregivers are upset about is, do they have enough protective equipment? Because that's been a big issue. Do I have enough masks, gloves, face shields, all of those things that keep people from getting sick for the caregivers? And that's been a real problem in the whole country because we've outsourced everything in the country. So we don't make any of these masks or shields in the United States anymore. So we didn't have enough to give our people. So our supply chain people, we got masks from Turkey, from China, from all around the world to try to make sure that we're protecting our people. I think your people want to know the truth, and then they want to know you're doing everything to make them safe. And then that's really, really important to them. So as a leader, I need to make sure I'm doing everything I can to keep our employees safe, that they get the right equipment and they're supported. And so far, everyone's held together really nicely. I'm just a little worried because this is going to take a while, right? This is not going to be over quickly,
So I think you were the one who told me that like your timeline for shelter in place is 8 weeks, but you told that to me like a couple weeks ago, right?
Right.
And I have to tell you, like, I immediately talked to all of my like panicking friends because, well, everybody was panicking because they don't know for how long. And I just told them like, okay, so this person who knows what he's talking about told me 8 weeks. So just survive 8 weeks and then we'll see. And it actually had a huge effect on my friends who not only had to work from home, but they also with kids, but they also had to teach their kids while working from home. And like, this was just a lot on them because they also just couldn't plan forward and they didn't know for how long. So just giving somebody a timeline that it's probably going to be something like 8 weeks calmed a lot of my friends down. So what is your timeline now? What do you think, how for the shelter in place particularly?
So right now, in the Western states, we're talking about May 4th as the
Uh-huh.
date. And the question is it May 4th or is it May 11th? So I would say the first week or two in May, we're going to start to kind of ease off of some of the restrictions. So being able to go outside more, kind of being good, but to do it in a smart way. Um, Also, some places that people go to work, if they can do enough testing, allowing them to go back to work and being able to do that. So it's like what Dr. Fauci is talking about. You got to do it slowly, a little bit at a time. But I think once people know there's kind of an end in sight, everyone can't run out and go to the beach at the same time or do all of that. But to have a little bit more where you can get out and kind of be outside a little bit more, carefully maybe open up some stores, some smaller stores, being able to do that. But then watching to see that there's not another spike in virus. So you start to let off those restrictions slowly, but most of us are thinking about the second week of May.
So what
So
I'm
May 4th,
uh-huh. May 4th.
May 4th, May 11th, something in that range.
What I'm having a hard
For the
time
West Coast.
understanding, for the West Coast, thank you. What I'm having a hard time understanding is what's going to change by then.
So what happens is that you've driven the curve down, and there's a thing, it's a complicated mathematical formula, but it's the infectivity rate. So when COVID started out, one patient could infect 5 or 6 people on average. Once you get below one, like where one person's not even infecting one person, the curve starts to go down, so you start to get less and less transfer. So that lets more people be able to be outside, be, doing more of the things they usually do. The other thing that starts to happen is that there starts to build some immunity. Like you may have antibody. I know I have antibodies already for COVID.
Oh, wow.
I
You
test.
already had it?
Yep. So one of my colleagues brought some testing in. So I've been testing all the people up here in my headquarters. And I had a cough probably like 6 or 8 weeks ago, dry cough, some of that. It was a little unusual, a headache, no fever, no chills, nothing else. So when I tested my antibodies, IgG antibodies, tells me I'm already now immune to COVID.
Oh,
And
wow.
when I tested 20 people here, 3 tested positive that they have antibodies. So I bet if I took 30 people in your neighborhood and started going, okay, test, you'll find that about 10, 15% already have had exposure and now have antibodies to COVID-19. So that also helps us in terms of, so no one can spread the virus to me right now because I already have antibodies. We can argue whether that's true 6 months from now, but right now, I could walk out into a whole room of COVID patients. I'm not going to get it because I have the antibodies. So that also helps us in terms of how much spread there can be of this whole disease. So that starts to get better as we go forward.
There is some rock star immune system you've got. Wow. That is
Well,
impressive.
but a lot of people that get COVID, it's relatively mild, and that's the take-home message. That's something that you and I would have thought, oh, I don't know, felt like allergies, have a sore throat, dry cough, I had a headache, and then it went away after about 7, 8 days. Most of the time you'd say nothing, but that's how COVID can also present asymptomatic without any symptoms, or it can present with severe pulmonary symptoms where you end up in the hospital. I mean, so there's a whole spectrum of how this can present.
So here's what you mentioned something about it before, and I couldn't understand. Could you please clarify? So there's something about not how good your immune system is, but how your immune system reacts. I didn't quite
Well,
understand.
so the immune system, which we don't know as much as we should know, reacts differently. Your immune system acts differently than mine, than someone else's. And we can't understand why in certain people that are healthy, their immune system reacts horribly to COVID-19. Other people, it's like nothing, right? It just shakes it off and everything else. We don't understand why that is. It could be genetic. It could be the way just our genes, the way of our immune system is configured. There could be susceptibilities that we don't know about, particularly with the virus. So those are a lot of the things that people are thinking about. But it's very, very clear that different people's immune systems reacts differently to this virus. We don't all react to it the same way. But it's also the same way with influenza, right? If you get the flu, you may be laid up in bed. A friend of yours may say, well, I had a cough, a little congestion, nothing else. So it depends on how your own body reacts to that as well.
This is interesting. When the whole thing started, like got real for me, because it started far away, and it was a while until I felt that this was real and was concerning me, because I commute by bicycle, and I commute by bicycle in the city. I just right away told myself that I have a lot higher chance to die on the road than from this. So, so I'm fine. And that was like the best thing I ever told myself, because I was like, okay, so I'm taking this risk. It's just not a higher risk of death for me, I feel, than from dying of everything else that I'm exposing myself to daily, such as bicycle. So okay. I was also, I kind of just want to know also about just your experience of this, because I understand you're like, well, I'm a doctor and I've been a doctor for 40 plus years, and I've been running this clinics for many years. I have experience, but like, what is different for you?
Well, what I think is different, I mean, it's just so odd being in an empty city, right? You go around, there's no one there. I come into the office, I kind of feel like Macbeth. You have these big 4-story office and I'm roaming around, there's no one here, right? We only have people here. So it's kind of odd because we're so used to working in such a social way, right? I mean, we we kind of meet in groups, we kind of think about stuff, and all that's gone, and we're all doing what you and I are doing right now. We're all on video. We do video chats. We have 12 people. We just did a board meeting this morning, all on video. And it's also given you a chance. I used to be in an airplane at least once or twice a week. And now I haven't flown in an airplane in 6 weeks. And I go, wow, this is really good. So there's things about it that are, and then I've thought a lot about the environment. So it's never been clearer, right? I mean, there's no cars on the road. I can see the Cascade Mountains. Everything, the pressure on the environment's gone down, way down, right? Energy, all of those types of things. And then I think people have also spent more time actually at home reading, thinking about stuff, talking. So those have been some of the byproducts that have been good. What I worry a lot about is just the economics of how many people have lost their jobs, and how does someone who works in a restaurant, and then you see the number of people that are lining up for food, and it's uncovering a lot of things that were there that people weren't thinking enough about. So hopefully people are thinking more about it. People are also thinking more about what doctors and nurses and technicians do every day. They really hadn't thought about it. Like I see these reporters that go around with their cameras in an ICU and they go, oh my gosh, look at what's going on here. I go, that looks like that every day. That's kind of what we do. But I think they're having more of an appreciation for what caregivers do. So that's been a good part of it. But I think what happens is you don't have enough, I'm just trying to get everything done that we have to. You got a lot of people that are counting on you. But I've kind of kept up. You keep up with your friends and you try to do those things. But it's just so different, right? And I don't think the world will be the same after this, right? It's going to be different in terms of how we think about how we communicate, what we do. Is it that important to go to 15 meetings like all the time and whatnot, or how do we do that differently? So those are the things that I keep thinking about. And then I've been working on a paper about what healthcare looks like 6 months post COVID. We're doing 12,000 televisits a day. 12,000 televisits like this. Like if you were my patient, doing, instead of you coming to my office, we're doing it like this together. And that's not going to go back, right? I mean, we're not going to change from doing that. That it's pretty convenient, for a lot of folks to be able to talk to their doctor or their nurse online instead of having to run to a clinic somewhere and do everything else. Now, certain things you have to have. You can't have surgery over, a telehealth visit, but it's going to change a lot of the way we're organized. I think the other thing that it's shown is that every American needs good health care. So every American needs access, particularly to great primary care, preventive health, because otherwise, part of the reason why the country's not doing as well with COVID is that people aren't healthy enough, right? They have concomitant disease. So I'm hopeful that coming out of this, we can think about better ways to rethink the American health system, which is kind of a mess. So that's what keeps me awake at night. That's what I keep thinking about in terms of what's going on.
I really hope also that the minimum wage workers will be appreciated because they're running everything now,
Yeah.
and they don't have
Right.
protected gear, and they're still being paid nothing.
Well, I think they're finally being appreciated for what they do. So it's the service workers, the people that drive the buses, the people that work in the grocery store. It's all the service employees. And, when I grew up, I worked in my dad's business, and I worked summers delivering refrigerators. And you got a real appreciation for being a service worker and how people just kind of discard you, right? They say, oh, you're just carrying my refrigerator for me, And I think people, I hope, will take another look at some of the people that work for them and what that relationship is like, that when there's no one to pick your vegetables or to do this, those folks are just as important as anyone else that's out there. So I'm hoping that there's more of an appreciation for that.
I just had a question. Oh, I do have a question. It came back. So what do you think people should look for news? Because there is a lot of news and it's on everything, and I cannot find my balance. My balance so far is that I have you as my source of news, and that's it. Like, I'm not asking anybody else about COVID because it's just panic from every corner. So where would you recommend if I need to learn what's going on? Where would I go, and how often do you think I should go in order to keep my mental health hygiene together?
So, yeah, I would limit the watching stuff on television to no more than like 60 to 90 minutes. That's about all I can take. I turn it on. I want to kind of hear just some of the things that are going on. And when I can, I sometimes actually watch the BBC instead of our news, because I want to get some sense of what's actually happening in the world around us, because it's not just COVID-19. There are other things that are happening. So then what I do when I go online, I look at things like Scientific American. I look at reputable journals that are thoughtful about this. And I spend a lot of time reading their articles because they've put some thought into it. I think some of the reporters, like from the New York Times and some of the, big outlets, do some really thoughtful reporting where they try to analyze what's known, and it's more facts than it is. I search a lot for facts because I really want to understand what people are doing and what scientists are thinking. So I look for reputable scientific journals. And I think for the general public, it's looking at, well-vetted outlets, like places like the Times, like Scientific American, where they're really thinking a lot about the issues that are out there. I'd look at things like the Mayo Clinic, because they're kind of a trusted resource where they generally try to put things out that make sense. If I want to look at things about COVID, that's where I'm looking. But though you got to go to trusted sources. You can't be out on social media. Oh my God, that's going to drive you crazy, and it's just going to scare you to death. Like just having the TV on scares you to death. Overall, things are going to get better. This is the thing I tell people: things will get better. They're going to get better next month. They'll get better the month after that. Continue to do all the common sense things that you're doing, and you're doing all those, and then just spend some time kind of renewing yourself. Right? This is a great time to I do more reading now than I've done before, and kind of do things that help myself. I think it's really critical to get exercise every day.
Okay.
So I don't know if right. Are you going out on your bike every day or doing something or walking?
Absolutely. Oh yeah, absolutely.
It helps me so much. I go for an hour or two walk and I'm better. I feel better about it. And I think paying attention to yourself is really, really important, and trying to avoid all this extraneous stuff from social media or from the news outlets on TV, because they keep showing the same stuff over and over again. And, they keep saying, well, 30,000 people in the United States have died of COVID. Well, we've already predicted that the number is probably going to be 60,000, so we kind of know that. We were thinking it was going to be 250,000, so it's getting better all the time. We don't need to scare people to death. Things are going the right way.
So I have two more questions from my roommates. Can I ask you my questions
Sure.
from my roommates? So my roommate Leo, he deals with cash a lot. So he just wanted to ask, is it safe to deal with cash? Does he need to wear gloves? Can he just what's up?
But I would do two things. One, depends on how much cash you're dealing with. If you're dealing with a lot of cash, I'd make sure I have gloves on. The key when you're touching cash is not to touch your face or your mouth, right? Because the minute you're touching cash, even if you have gloves on, if you go and touch your eyes or your mouth, that's how the virus gets transmitted. So what I would do is, if I'm working with a lot of cash, if I have gloves on or I don't, as soon as I'm doing that, what do? I go and wash my hands really carefully. Or if I can't get to a sink, I keep sanitizer with me, so you keep doing that. And that just that kills, because the good thing is on your hands, you can kill the virus pretty easily. It's pretty easy to kill the virus, but you just got to be really fastidious about washing after you've touched something like money, and make sure that you don't touch your face. Don't, doing all of that.
So if you're going into the room there people were and now they're no longer, is the virus in the room or no?
It depends. That's a great question. The virus can live on surfaces, right? So if I was in a room and, I'd want to make sure I'm cleaning down stuff a lot, right? So even in the house, in the apartment where you are, I just make sure occasionally go through with some Lysol, cleaning off the arms of the chairs, the table. It just keeps the virus count down. So I would just be a little bit more attentive to that now than ever. Making sure you clean off the knob. Like we do that here. We're cleaning off the knobs on the doors and everything else, just to keep things, keep any kind of viral content down as much as possible. In the air, technically, but you guys are all living in the same place. So by now, you're either all infected or not infected. But if someone new comes in, the real issue is when someone else comes into your space, you don't know where they've been, right? And that's kind of the issue. That's why we tell people, just to stay with the people that you're with, and don't invite other people over for a party, because you don't know where they've been and everything else that's going on.
Well, we go out to buy food and then we come back. We go to farmers market and then we come back, so we still touch things. In terms of food, is it safe when somebody else cooks food for you? Or transmitted through food? It's not transmitted through food, right?
Oh, no. And what we do, to support our restaurants in Seattle, we're ordering from restaurants all the time because we want to support the people there that are working. So instead of, we could make the food in our house, but instead we try different restaurants so that, we support them. And usually what they do, a lot of them have been cooking family style so that they set up the meals already. So when you come to get them, they're already ready and you've already paid for them online. So there's not a lot of contact that's there. So it's perfectly fine.
Okay, that's okay. My roommate works in a biolab. She keeps on telling me that it's safe to eat food that other people
Yeah.
will. What if someone coughed in my food? I want to eat this.
Oh,
Okay.
yeah,
Okay.
you're fine. You're totally fine. You can't drive yourself crazy. The virus is very sensitive to heat, right? So when you have, particularly warm food and stuff, it's not going to survive. But you can't drive yourself crazy that way.
Mhm.
It's generally not transmitted through food, through something that you're going to eat, and even things on surfaces. Like I know, so if you're really wanting, it comes in a container. Take the container, you put the food on a plate, and then go and wash your hands. Right, throw out everything that's there, and eat your food, and you're perfectly fine.
So in terms of mask in my pocket, so this is something that also you recommended, to have a mask in my
Right.
pocket. I have a mask in my pocket where I go, and then I put it on, whenever I
Yeah.
am about to come in contact with people. So this is what, and then when I do that, I was like, but my hands are dirty. I just like touch stuff, and now I'm touching this mask, and I'm putting it on my face. Am I also being like driving myself crazy for no reason?
You are. Yeah.
I could just like put a
Just
mask
keep
on
just
and
what I would do, let's say if I knew I was going out to the farmer's market, right? So I would wash my hands, I put my mask on, right? And the mask is more to protect other people from you. It doesn't protect you. Remember that, because it's keeping your droplets in your air inside here. But if I was at a farmer's market where there's a lot of people around, I would want everyone to have a mask on so they're not transmitting things back and forth. And that's just good practice. Then when I come home, I'd make sure the first thing I do, I wash my hands, because I've been out, I've been touching stuff and everything else. And then trying to keep, the good thing about masks sometimes is that you tend not to touch your face.
yes, actually. I was also thinking like a full face makeup also works like
Yeah,
this. But
sure. Yeah,
there's something you said right now and I didn't understand. So you're saying the mask does not protect you, it only protects people from you? What do you mean it
well,
doesn't protect me?
right. You're not filtering out things with this. But what it's doing is it's preventing you from aerosolizing to other people. Remember you talked about 6 feet? If you can keep 6 feet from people, I generally can't transmit virus to you. But if we're in closer quarters, like we're in the supermarket or we're at the farmer's market, I have a mask on. I'm not going to be able to aerosolize stuff. So if we all do it, we protect each other, right? But the mask itself doesn't help you. Sometimes things can get through the mask. So it more helps protect other people from you.
It doesn't help me at all. It doesn't make me at all safer. It makes me a little bit safer.
Makes you a little bit safer, but it's just good practice that when people are out, in particular, if you're going out for a walk, you don't need a mask on.
Yeah,
Just what I do when I'm walking, down the street, and I see some other people coming, I just move to the middle of the street. I keep some distance, right? If you keep that distance, you're not going to transmit anything, right? So when you're walking, you want to kind of try to walk as much as you can. If you're walking with someone or alone, then you want to walk in the middle of the street. You want to walk away from other people.
I was walking yesterday. I was walking on the street because there are no cars and there were
Right?
people on the sidewalk. So I'm walking on the street and then the
Yeah.
cops stop me and be like, don't walk on the street. I'm like, excuse me, but it's safer for me to walk on the street than walk
Well,
over there.
he's wrong. He's absolutely wrong, right? You're right. So you got it.
I'm I'm wrong and I'm woman and I'm white, so I could actually talk to them like this. Be like, this is
Yeah. But you
bogus.
were doing the right. Yeah, you were doing the right thing.
But one last question. So,
Sure.
actually, two questions. So, one question that I just now thought of. So, my dad, he has like a small construction company, and construction companies in Russia right now are working. So the regulations are smaller than here. So it's not everything shut down. Construction still work. Actually, there is still construction here as well. So he's an administrative position. He's running it. So there's still people that he's talking to, and he promises me to wear a mask every time he talks to everybody. But I thought that protects him. But turns out that it doesn't. What can he do to be safer in this? What can I tell him?
No, I wear a mask, but he should have the people he's working with wearing masks too, right?
Uh,
But if they're working together, they all should be wearing a mask, right? So that would help. And then to make sure that if someone feels like they're sick, they don't come to work. Because that's how things, sometimes, if someone has a fever or something, they come to work, they spread it to everyone else. That's the danger. But particularly in construction, you're not working on top of each other. You generally, there's some distance. But if they're on a work site together and there are a number of them, they all should at least have some sort of mask on.
yeah, he's in the office, so people
Oh,
come to an office.
well, it depends on how crowded the office is, right?
Not
The
crowded.
office is, yeah, then it's probably like me. It's probably pretty safe. He's probably in good shape doing that. And he should just do the same things you and I talked about, washing hands, making sure, that he's not touching his face and doing all that. And just limiting the number of folks that he's with, the number of contacts and whatnot.
Okay, thank you. So the last question from
Yeah.
my other roommate. So she asked you, it's actually a two-sided question. What surprised you the most and what disappointed you the most?
So I think what surprised me the most is how people have really stepped up, right? I've been really impressed with my people, how they've dug in. They started making masks when we didn't have enough masks. They just jumped in. I walked down to one of the offices and she was starting to make face shields. And then she found a company and they've been making like 1,000 face shields a day. So what surprised me was how much ingenuity, innovation there was out there. And then I think what's disappointed me the most has just been the way the government has responded to this whole pandemic. And it's been just confusing and name calling, and between the federal government and the state government. And, we're all trying to just take care of ourselves and do it. And it's just the federal response, the government response to it's been inadequate, and how they've responded. So that's been the biggest disappointment.
Okay, so what's the hope then? Not because of disappointed, but in general, what's the hope?
The hope is that inherently most people are incredibly good and resourceful, and they're going to get through this. And I've seen a lot of courage on the part of caregivers, of patients, of people, and their resilience, right? They've been pretty resilient. We told American people 8 weeks, you're staying home. And this is an authoritarian state where we can just mandate everyone does. But for the most part, people are listening, right? They're doing the right thing. And that's pretty encouraging. So that makes me very hopeful. Well, we'll get through this. I just hope on the other end of it, we come out better than we were before.
Hopefully. It's like a collaborative game.
Right.
So we have to figure
Well,
it out.
it is, right? It's social dependency, right? I'm only going to be as healthy as the people around me are looking and taking care of stuff. So there is a dependency that you have on everyone else doing the right thing.
Yeah, this is very interesting because it seems to be that protecting the most vulnerable is good for everybody in this situation, very apparently. So that's
exactly.
So okay, I am going to stop video. Thank you for answering the questions. I'm not gonna hang up, but I'm gonna stop the video for now. I appreciate this. I appreciate you answering all my questions, because it's hard to find information, because I do not read Scientific American and my sources of information are just full of panic, and I just had to shut them down.
Well,
So
you can call anytime, right? And
I,
just drop a message. Yeah.
I will.
Oh yeah,
I
sure.
will.
I
Thank
do it
you.
for all my friends, right? I'm kind of there, and they say, Rod, what should we do about this? And I just talked to a university professor, and he's trying to figure out what to do with his students in September. So I talked to him for an hour. He said, okay, I feel better. I think at least I have an idea and a plan that to go forward. So I'd love to do it.
Okay. Well, thank you. I'm gonna stop the video in a second, but I'm not hanging up.